All right. Hello, everybody. Thanks for joining us. Sorry that we're a couple minutes late coming to you live. We've been chit-chatting for 3 or 4 minutes thinking that we were talking to you, and we were not. So thanks so much for being here. My name is Lindsey Bowns. I am the mom and certified doula behind Adora Birth and Wellness. And if you don't know, a doula is a pregnancy and birth coach. I'm not a midwife or a nurse. I don't catch babies. A lot of what I do centers around exactly what we're here to do tonight, which is to provide you with evidence-based information to help you learn about birth and pregnancy and assist you in decision-making around your birth and postpartum experience. And tonight I am joined by Mercedes, who is a lactation consultant and a physiotherapist and the owner of Vida Health and Wellness in Calgary. So I'm going to let her jump in and tell you about her role.
Yeah, thanks, Lindsay. So a lactation consultant is somebody who facilitates infant feeding, and that could be ideally breastfeeding, but any form of feeding is what we support. And we look at infant feeding from the maternal perspective, the lactating parent perspective, as well as the infant perspective. And then we look at it from the societal perspective and trying to balance the things that benefit all three parties in infant feeding, which sometimes can be a bit of a juggling act, but that's the art and the science behind lactation consulting. And so a couple of things to look for when somebody claims to be a lactation consultant that's important to know is that in many places it's not a regulated term. And so it's important to find out what qualifications somebody has when they say that they're a lactation consultant. I myself am an international board certified lactation consultant, or IBCLC. And what that means is that IBCLCs, they do a certain amount of training, clinical hours, other titles that you might see are like CLC, CLE. There are quite a few out there, and so it's important to find that out. And then from a physiotherapist perspective, I really look at kind of a more narrow perspective of infant feeding, which is the mechanics of it. So I look at the baby's jaw and tongue movements and neck movements and how they get to the breast and now how they suck and swallow during the feed, as well as the mom's or the lactating parent's breast tissue itself. And does it have inflammation? Is that person experiencing pain? That kind of thing. So much more narrow. And so tonight I'm going to be wearing my IBCLC hat primarily because that allows me to answer broader questions.
Perfect. Well, thanks so much for getting us started with that. And before we open up the discussion, I just want anybody who's joining us live to keep in mind that Mercedes and I are discussing breastfeeding recommendations as per the World Health Organization, the Center for Disease Control, and also Alberta Health Services, because we are both from the Calgary region. So I know some of you are not from Calgary or from Alberta. Keep in mind that the overarching recommendations of what we want to do for breastfeeding during a pandemic are going to be the same. They are broad, but different policies and procedures may be implemented by your hospital or your health region. So if there's something specific that you really need an answer on, it's great to take this information back to your OB, your family doctor, or an IBCLC in your area to double check on those things. I didn't have any specific questions submitted, so I assume that you are all here to just hear what we have to say. So I think the very first question to ask tonight that is burning in many of your minds is breastfeeding recommended during COVID-19?
And that's a big question. And I think that you're right. A lot of people are asking themselves, is this a time to breastfeed? Is it an appropriate time to breastfeed? And when we look at what breastfeeding is, we have to remember that breastfeeding has benefits for both the parent and the baby. And what we know right now about this virus, about the infection and the condition that it causes is actually quite a bit. There are lots of scientists that are looking at this, and the World Health Organization and the Society for Obstetricians and Gynecologists of Canada are recommending that breastfeeding should be done if the parent is able to do so. So if they're not sick to the point where they are physically unable to breastfeed, then they are absolutely recommending that it continue to happen for those benefits, and also because in dyads, in parent-infant duos that are breastfeeding, they're not seeing adverse consequences.
Well, that's great to hear. And so we've kind of touched on if you are sick in general, if you have a cold or the flu, something like that, a stomach flu, then it is still a great idea to breastfeed, and there are benefits for both mom and baby for doing so. But what specifically if you are sick with COVID-19? So if you already have an established breastfeeding relationship, or unfortunately you happen to be sick during your birth, are you still breastfeeding if you test positive with COVID-19?
So like I said, a person who's physically too sick to do so, they need to look at alternate forms of milk removal and infant feeding, and that really needs to be discussed with the health team depending on their individual circumstances. Those are going to be few and far between based on what we know about this virus specifically and how many people have those more severe cases. A person who's symptomatic but can still breastfeed should be allowed to do so for those benefits, partly because the body's going to continue to make milk. And if it's not removed, then there are other complications like mastitis that are going to further tax the immune system. So we need to consider that when weighing whether or not somebody's going to breastfeed or even just remove the milk that the body is naturally going to produce, whether you're sick or not. If you're sick, your body actually ramps up your immune system in response, and then your infant benefits from that ramped up immune system. You make antibodies and other immune components that are available to your baby through the milk and can be protective. And so it's a really good idea to deliver that milk if you can, if you're physically able to do so. And right now, one of the benefits if you're not in the hospital and you're at home is if you're having any symptoms, whether it's of this virus or cold or flu or anything else, you're probably being told by local authorities to self-isolate and keep yourself at home. And breast milk is really the only thing that's available without leaving the house. And so there's no need to purchase equipment like a pump or bottles. There's no need to purchase or get donor milk or formula. And so it can be really beneficial if you're having to stay home for, here they're saying 14 days. It can be really beneficial to establish and maintain a breastfeeding relationship in the best way that you can to deliver health benefits to yourself by preventing other complications, health benefits to your baby, and then being able to fully self-isolate and not have to go out. That being said, it can be really hard to breastfeed through illness. And I think that a lot of parents have been there, even if they haven't had this specific infection. A lot of parents have had the flu, and it is hard to breastfeed through illness. So if you live with someone, you can ask them to support you. They can make sure that you're well hydrated. They can make sure that you're eating regularly and that you have easy access to hand washing. So if you run out of soap, or they can set you up, for example, on the sofa near the guest bathroom, something like that, where you're really set up for success.
All right, and we've talked about hand washing, but again, if you are positive with COVID-19, or even just if you are symptomatic and maybe don't get tested, or you're waiting for your test results, and we want to assume that you're positive and just take all the precautions, what other things should we be doing while breastfeeding to protect baby?
And so according to all the sources that I've seen, which I checked, the Lancet, which is a prominent scientific journal, the Centers for Disease Control in the US, the World Health Organization, and the Society for Obstetricians and Gynecologists of Canada, all of them agreed that breastfeeding can take place with either confirmed or suspected COVID-19 if precautions are followed. And so they're saying hand washing before and after touching your infant, and wearing a mask during breastfeeding.
Right, and those are pretty simple steps to take. I know that if you are listening, you will know that there is obviously a shortage of N95, the very fancy specialized medical grade masks available, but we're not necessarily talking about that kind of mask. We're talking about a very basic, a dental hygiene kind of mask, or a painter's mask, anything that you can access, wearing a bandana if that's what it comes to, if you are self-isolating and can't get out to get real equipment, something that just provides a barrier between you and baby while you're feeding.
Yeah, I think it's going to come down to an individual case, and that those are the recommendations. Yeah.
All right. And if you do find yourself seriously ill, either with COVID-19 or just something else during the course of your breastfeeding relationship, and you're unable to breastfeed, what should you be considering doing instead?
Yeah, so I think that's a very big question. And there are recommendations in terms of everybody in general and what you should do ideally if you're not able to breastfeed. So right now, there's no information specific to this virus or this condition in terms of what to do if you're unable to breastfeed. But just in general, when we look at feeding, you can split it up into what to feed and how to feed. And so what to feed, preferably your own milk. So that would be, for example, if not at the breast, then pumped and delivered via another format. Then next ideal would be donor milk, because that is still breast milk made by a human, just not yourself. And then next to that would be formula. And that's according to the World Health Organization. And then when we look at how to feed, of course, ideally at the breast would be first. Excuse me. And then a lot of people are surprised to find out that there are alternatives to the bottle. So cup feeding can be a great way to deliver milk from Zoom.
Thanks so much for sticking with us, everybody. I know, yeah, I see Anna Maria says that we are back in business, so that is awesome. Let's jump back in kind of where we left off, which is what do we want to do instead of breastfeeding when breastfeeding is not an option? So we talked about the what, the option of pumping your own milk, using donor milk, and then using formula as an alternative, and some of the hows being obviously bottle feeding, but there were other methods as well.
Yeah, so with the how to feed, breast obviously is ideal. So the supplemental nursing system, for example, would allow you to feed your own milk at the breast with a tube kind of going into the corner of baby's mouth, adding a little bit more. And then there are lots of other options. So you can cup feed, syringe feed, spoon feed, and this is where lactation consultants can get really creative and help you find a solution that works for you.
Awesome. And just a reminder to everyone that if anything that we're talking about during the course of this broadcast brings up a question for you, leave it in the comments and we'll make sure to answer it right away. So now that we know what we can do instead of breastfeeding, if we are nursing, sometimes we experience physical challenges like thrush or clogged ducts, mastitis. But right now, I can imagine that a lot of you are pretty hesitant to go to a doctor's office. I certainly would be. And so what kind of symptoms do we need to look out for those? And when do we really need to go see a healthcare provider, or do we have other options at this time?
That's a really good question. So I first want to address the reluctance to go into a doctor's office or to go see somebody. And I have to say the doctors that I know that work in this space in Calgary, the lactation doctors, they are taking tremendous precautions to make it a safe place for everybody to go to. They screen people before they come in. They are not allowing extra people to come in. Normally, you know, grandparents and everybody, the whole family and toddlers could come into the visit, but they're asking that other children and other members of the family please just stay home. So they're taking all kinds of precautions in addition to cleaning and wearing equipment and that kind of thing. So if somebody does need to go in to see a physician or to see a lactation consultant or public health or whoever it may be, please talk to them because they are taking lots of precautions to make it a safe place for everybody to go to. They take this very seriously. They don't want to get sick either. And so I just want everybody to know that they should feel comfortable at least calling them and talking to them, because we don't want you to be suffering at home without anybody to reach out to, right? Just call them and see what they can do, and just reach out to them and see how they can help. But in terms of the things to look for, there's a lot of things you can kind of take care of on your own or with a little bit of guidance. And so pain is often the first sign. And when people talk to me about, you know, is pain normal during breastfeeding? Because some people will say to you, oh yeah, it hurts a bit for everybody, or it hurts for the first latch and then it's gone. And different people have different opinions about what amount of pain is okay during breastfeeding. And where I like to draw the line is 2 places. So pain that is not okay to you is concerning during breastfeeding, because pain is one of the top reasons why people quit breastfeeding. And so if it's not okay to you, seek help, even if it's just a little bit or occasional pain, whatever is not okay to you. And the second thing is that breastfeeding should never be toe curling painful. Like, you should never be like making this face when you're about to latch. Right? You shouldn't dread the experience because of pain. And so if you are dreading it, or if you're like, okay, and then the pain goes away, go and talk to somebody, because that's a sign that that it's not a good latch, or that it's not good mechanics, and we can help with those things. Like, we help with those things every day. And so those are things to reach out for. The other ones are red skin, which can be a sign of thrush in the breast, or it can be a sign of inflammation, like black ducts, mastitis, that kind of thing, depending on where the redness is. So red skin, swelling, and then if those are paired with a change in your baby's behavior. So for example, a 4-month-old that suddenly won't feed off the right breast, and that right breast is feeling sore and swollen, that's a pretty good indication that there's something going on in there. And oftentimes breast inflammation, so engorgement, black ducts, that kind of thing, and even into mastitis, can be managed at home. The Academy of Breastfeeding Medicine, which is the group of doctors that specializes in breastfeeding, their recommendations for mastitis are actually conservative management for 24 hours. And then if no improvement, then seek physician care to consider antibiotics. The World Health Organization agrees that conservative management should be done first. So what that looks like is you can do what's called a therapeutic breast massage, which is a really gentle massage away from the nipple and towards the armpit to drain some of that inflammation and fluid out of the breast. And then that allows for the milk to flow. So after you do that breast massage, and we can link a video to the therapeutic breast massage in the comments, after you do that massage, you either hand express, you pump, or you get your baby to feed, but you get that milk out and take the pressure off of your duct and off of that breast tissue and allow it to recover. And if that doesn't help within 24 hours, or if you feel like your symptoms are getting worse, then talk to a doctor and see about getting an antibiotic. A little caveat on that is that if you are a healthcare professional and you are exposed to MRSA, which is an antibiotic-resistant strain of bacteria, then you might want to go in sooner, because there is a type of mastitis that's related to MRSA, and then those guys do definitely need specific antibiotics. In terms of, especially right now, I think there's a lot of people who are either former healthcare providers or retired or not currently working are now going into the hospitals. I think that's important to know. And then in terms of thrush, really that one you should definitely be getting assessed, partly because it looks like so many other medical conditions that it's hard to accurately diagnose. Like, you might be able to manage thrush independently on your own, but it's probably best to get it checked out if your nipple and areola are red, or if you're experiencing sharp shooting pain, those kinds of signs of thrush. Also, because you're going to have to treat your baby so that you don't pass it back and forth. So that one's a good one to get checked out.
Okay, and we did just get a comment from Anna Maria, who says, thank you. I was just diagnosed with mastitis today through a call with my midwives. So it's still pretty new to me. You're answering most of my questions already, but I have one breast that seems quite damaged, and the early latch is toe curling. I don't know how to fix it. I had a fever and I'm on antibiotics now, but I am seeing some breast inflammation. So do you have any specific suggestions for addressing that beyond what she's already done?
Yeah, I mean, it's hard to give advice without seeing you or meeting you, but I think in general, the advice that I would give to somebody with a situation like yours is that it sounds like there are three components that really stand out to me. One is your immediate symptoms, which is that inflammation. And so you can find that massage really does work. I know that sometimes we feel like, you know, you really got to get in there and dig in, but that's the depth that compresses them and doesn't allow the milk to flow. And so if we can get that swelling off and then allow the milk to flow, then that can relieve a lot of the symptoms. Some people find that applying an ice pack or something cold can be helpful as well with the inflammation. The Academy of Breastfeeding Medicine does talk about taking anti-inflammatories. As a physio and as a lactation consultant, I can't recommend that, but I can recommend that you talk to your midwife about whether or not taking anti-inflammatories is appropriate for you, especially with antibiotics and mixing things. So just ask that question of like that to them. But the other element is, okay, now we've got the inflammation off, we have the milk flowing, but if the latch isn't good and the mechanics aren't good and your baby's not removing the milk, then it might happen again and it might not get the chance to relieve that inflammation. And so talking to somebody and seeing someone either virtually or in person, whatever you're comfortable with right now, in terms of helping with your baby's latch mechanics, I think is going to be really key to resolving the underlying reason for this.
All right. And we know that establishing a breastfeeding relationship early is key. And if breastfeeding, especially exclusively breastfeeding, is our goal, we're going to work towards that. But if you're struggling, normally you would maybe go to a public health clinic, La Leche League, you would come see a lactation consultant such as yourself. If you're not feeling comfortable with something like that right now, what should you be doing at home?
So I think right now we're very fortunate that we are able to connect virtually like this, technical issues aside, because there's a lot that we can do through a virtual connection. I can see you, you can see me, and we can do virtual consults like this. And a lot of people all around the globe are starting to do this, especially in the light of this pandemic. A lot of us were doing it before. I was doing telehealth before for breastfeeding consults, but now it's really taken off. So that is definitely an option. So if there's a lactation consultant in your area, then reach out to them and find out, you know, can I do a virtual consult? Can I do a phone consult? Can we work this out where you can teach me what to do and I can learn how to be independent and self-sufficient and be able to do this on my own with some guidance. So sometimes some issues just require guidance, and we can definitely provide that. And so just reach out and ask to whoever's around you. A lot of La Leche League meetings are also happening online. And so same thing. And those really are no longer restricted by geographical region. So if there's somebody, for example, in my city, there's a great La Leche League way down on the other end of town. And so now people can access them and get into that great group. The other thing to keep in mind is that the reason why a lot of these lactation clinics are still open is because food is essential. And I think that sometimes we forget that babies eating is really, really important to society and to the babies and to the families, and it is essential. And so grocery stores are open, lactation clinics are open. So just call and ask and find out what they can do.
Right. And just in case you kind of missed that message buried in there, Mercedes is available for telehealth appointments through Vida Health and Wellness. So you can find information about that on their website and get in touch with her after this if that's something that you need today or coming up soon in your journey. Okay, if breastfeeding just is not working right now, we are unable to have a telehealth appointment or just need a short-term solution today or for the next couple of days, how should we bridge from breastfeeding to alternative feeding and back again?
So that is a very, very big question. And I'm very glad that you asked, because I'm sure that it's on the minds of a lot of people right now. And I think that I'm gonna say I'm probably not gonna fully answer it, because it completely depends on your case. So it depends on how old baby is, how experienced mom is in breastfeeding. It depends on whether baby was premature or not, and what their growth and development is. There are just so many factors in terms of what you can do coming off of the breast and then coming back onto the breast, and how successful some of those strategies are going to be. So I'm going to give some general guidelines, but there's no specific algorithm or formula to follow. And there's no guarantee that a baby who took the breast previously, even if they didn't take it very effectively or in a way that didn't cause pain, there's no guarantee that they'll take a bottle, and there's no guarantee that the baby that will take a bottle will then take a breast. And so it really is a matter of getting an individualized plan from somebody like a lactation consultant and making sure that you're set up for success. But there are general guidelines for things that are going to maximize your success. So the number one thing is, even if you are not able to feed at the breast for any reason, for any number of reasons, is to continue to have baby at the breast. So skin to skin is so important in terms of success with establishing breastfeeding, whether it's now or later on. And no baby is too old for skin to skin. It's not just for newborns. The other things that you can do are have mechanics for feeding, so that jaw movement and the tongue and the sucking and everything that are similar to breastfeeding, so that your baby learns, okay, this is how I get my milk. And then when you go to latch onto the breast, they go, this is how I get my milk. And they've learned those complex movements, and they've perfected them. So things like having a slow bottle. So one way to tell if your bottle is slow or fast flow, because they'll all say that they're slow flow, they'll make that claim, but one way to tell is to actually tip it upside down and see if any drips out. If it drips out, that's pretty fast. So it should stay within the bottle unless there's a force on it. If you tip it and kind of shake it a little bit and some comes out, that's still pretty fast. Like you should be able to tip it and have to really put some force on it for it to come out, because baby's suck actually is quite strong. If you ever put your finger in baby's mouth and have them suck, that's what it should take to get milk out of a bottle. It should not be easy, because you want them to be able to be strong and translate that over to the breast. Similar to that, you can look into something called paced bottle feeding. So at the breast, we have a letdown reflex. So that lasts about 30 to 60 seconds. You get this reflex that lets the milk come down towards the nipple, makes it accessible to the baby. And then there's a pause. And then another letdown, and then a pause. Then another letdown, and then a pause. And that's how a feed goes. So at the bottle, you can simulate that. And you can latch baby onto the bottle and then take a break, 30, 60 seconds and take a break, and slow it down like that so that they learn their pauses in between, and again, simulate what happens at the breast. And then if you're not able to breastfeed for whatever reason right now, ideally pump to give breast milk, and pump because you're going to continue to make milk. And so it's a good idea to remove it and use it if you've got it. But please talk to a lactation consultant to make a plan that's specific for you.
Okay, and so a next question related to pumping is when we are trying to do social distancing or self-isolating right now, when we are running into a situation where we don't want to go to the store, but we find that we need a pump or other breastfeeding supplies, what should we be doing in Calgary right now? Is it, do we go out and buy a pump? Is it safe to rent a pump? Is it safe to buy a used pump?
So pumps come in various different forms. So they can be a manual pump, which is one that you use with your hand and you squeeze. You can get an electric pump that has a motor. You can have a single pump, which does one breast at a time. You can get a double pump. And then another category or division of pumps is an open system versus a closed system. And so sometimes it'll say single user or multi-user, and those are synonymous with closed or open. And what that means is in an open system, the machine itself, and then into the bottle as well, the collection bottle. In a closed system or a multi-user system, the milk never actually goes into the machine. And so what that means is that if you have new tubes and new flanges and the parts that actually attach to the breast, then you can use the machine with multiple people because milk's never been in there. The thing with an open system or a single user pump system is that they're really, really difficult to clean because you have to clean in all of the parts and mechanics of the pump. So at any time, it's not a good idea to purchase or receive a single user or open system pump because they're really difficult to clean between users. All of the pumps that are rented either at the hospital or the pharmacies are going to be multi-user closed system pumps. In Canada, we are not able to get a specific brand called Spectra, but in the US they can, and that's a closed system pump that's readily available, for example. The Medela ones, the majority of them are actually open system pumps. So I called around today to several pharmacies to find out what they have available. And so as of today, March 26th in Calgary, some Shoppers Drug Mart have decided not to rent their pumps anymore in light of the pandemic. London Drugs still is renting pumps, and they told me that what they're doing is they always sterilize them when they come back, and right now they're not renting out any pumps within 3 days of somebody else using them. And so that's an extra precaution that they're taking at this time, but they still want to make the pumps available to the people who need them. So I think what's important to do is ask the pharmacist what their procedures are for sterilizing and making the equipment safe to use. And then if you're comfortable with their answer and you're comfortable renting a pump, I see no reason not to. There's no literature that says that any infection has been caused from a breast pump, but there's also no study on it. So right now it comes down to asking questions and doing what you feel most comfortable with. And when it comes to, Kijiji or Craigslist or getting them secondhand from somebody else, right now, most individuals just don't have the proper equipment or cleaning supplies to sterilize a borrowed pump. There's a huge shortage on cleaning supplies. And so I would be very hesitant to accept one, especially because there's some evidence that's coming out that, that asymptomatic individuals are able to transmit this specific virus and that it can live on surfaces for quite a few days. And so personally right now, I wouldn't recommend using one or borrowing one or receiving one from somebody who's not able to properly sterilize it. And then of course you always want to get your own flange and tubes and clean it yourself when you get home.
Right, okay, and something that we can clarify from, again, the WHO and the CDC is, as far as research has shown us so far, COVID-19 is not transmittable through breast milk. However, there is a risk that any breast pump that you receive as, a loaner or a rental could be contaminated with, droplets from somebody's sneeze or cough. So that's where we're really looking for the sterilization.
Yeah, exactly. Yeah, they have actually examined breast milk looking for COVID-19 and none has been found, which makes sense with the type of virus that this is, which is a respiratory virus that causes a respiratory illness. And so right now the thinking is that it's transmitted through aerosol or droplet, which means that the person has to sneeze or cough or exhale it out. Yeah, and then when that lands on a surface, that's how it can be picked up.
Okay, and when we are doing right now social distancing or self-isolation, or maybe you're home with a newborn and just being extra careful, we're probably maybe not taking care of ourselves as well as we would like in terms of diet. You know, we're eating out of our freezer, we're not making gourmet meals or going to the store every day for fresh ingredients. Maybe we're not hydrating as well as we should. We're probably pretty stressed, and especially as a newborn parent, not sleeping the way we would like to. So what can we do with those specific things and anything else to help maintain our supply?
Yeah, so I think there's lots of information about things to increase your supply or things to decrease your supply out there. And I am happy to let people know that in terms of food intake, what really matters is that you're getting enough calories. And so you don't have to eat gourmet right now. If that's not what you have on hand and you have a brand new baby or even a 6-month-old baby, and you're just eating what you can, and just make sure that you're eating when you're hungry. So not depriving yourself, not skipping your meals. I think right now, one of the bigger things with self-isolation is that we have really no sense of what time it is. We don't have those routines. We're not at work. We're not going outside and getting that sunlight cue. We're not interacting with people and sticking to our regular routines. And so that sense of time can slip by. And a lot of people will just forget to eat. And then by the time they do eat, they'll make something quick and they do. And it's really more of a snack than a meal. And so it can be really helpful to use technology in this case and set alarms on your phone if you are a person who just kind of loses track of time these days, which many of us do, and use those tools as external cues to remind you and set up a bit of a routine as best you can. The other thing with water intake, the water intake actually doesn't increase milk supply. So it's not like if you drink 8 liters of water a day, you're going to boost your milk supply. A lot of women have tried, it just doesn't work, unfortunately. You're just going to really overwork your kidneys. And so breastfeeding and pumping and lactating in general is going to make you more thirsty, because oxytocin, which is the hormone that's responsible for that milk ejection reflex, also makes you thirsty and makes you have to pee. And so a lot of women naturally will drink more water during lactation. They'll drink about 3 liters a day, but the recommendation is to just drink to thirst. So drink when you're thirsty and stay hydrated. It doesn't have to be water either. So if you don't like drinking water, you can get your fluid intake with soup or smoothies or whatever you enjoy drinking. And then one thing that when we're trying not to go grocery shopping, even if we're not symptomatic and we're not needing to isolate, but if we're trying not to go grocery shopping or we just don't have time because we have a new baby or a baby, we might prioritize getting those non-perishable items. So it can be a good idea to ask someone to drop off fresh fruits and vegetables at your home and then just wash them thoroughly. And then just wash them thoroughly. Sorry, I got a call blasting into my ears. One thing about diet that you might be interested to know is that the fat in our diet actually does influence breast milk. Not in terms of the amount is pretty set from person to person, but in terms of the type of fat. So saturated versus unsaturated fat, for example. So if you eat some of those higher quality fats, then your breast milk will actually have some of those higher quality fats as well. So that's the one that you want to key in on in terms of nutrition. But other than that, your body will take whatever nutrients it needs from your body and from your reserves in order to make a really nutritious milk for your baby. In terms of stress and sleep, so common in parenting, and I think 100 times that right now, both stress and sleep. And so here, I think it's important to remember that we're not alone. We might be physically apart, But one thing I'm seeing is that we're so much more connected than we were even a few weeks ago. And so sometimes as new parents or as parents in general, we can feel so alone, and this physical isolation can amplify that. And so it can take a conscious effort to reach out and talk to people. But I'm finding in the last few weeks that so many people are willing to talk and happy to talk, and they're so reaching out saying, you know, hey, can we Skype and have a date tonight, or joining a mom group on Facebook, or any of those kinds of connections can be really helpful right now, because as humans, we're social beings and we need that. And I'd recommend continuing to do the things that bring you joy in whatever way you can. So if you are a knitter, then knit with your baby in your lap, or, you know, in a carrier, and you can use the needles around the carrier. Find ways to do something that you still enjoy, something that isn't only parenting, because parenting is around the clock and you need to be you. And then sleep when you can. Sleep is tough when you have a new baby. Sleep when you can, and take those opportunities. Take turns with the other person in your house, and try to be kind to yourself.
Yeah, I think, you know, this virus and our public reaction to it and some of our restrictions is really a reminder to address the things
Lindsey,
that we
I just can't hear you.
Anybody else hear me?
I can't hear you. So again, we need you guys in the comments. Let us know if you can hear Lindsey or if it's just me.
Anna Maria says she can hear both of us. Nothing. Oh,
No, I can't hear you.
So I'm just going to open up a quick chat here so that Mercedes can see what we're talking about.
Oh, they can hear. Okay, we're good.
That was all the questions that I had for Mercedes, and all the information that I thought would be helpful for the rest of you tonight. So if you have any last minute questions, drop them in the comments so that we can answer them before we go. But otherwise, thank you so much for joining us tonight. We are going to put together this information in one key document, and that's going to be posted to my blog and as well as to the Vida Health and Wellness website as of tomorrow. So you can follow along on Facebook or Instagram, both of our accounts. We're going to update the information there. And as of tomorrow, you will be able to find that one-page tip sheet. If you have any follow-up questions, feel free to get in touch with either myself directly or Mercedes. So that's Adora Birth and Wellness or Vida Health and Wellness. And Mercedes is offering right now virtual breastfeeding consultations. So you can connect with her by phone or by email to set those up. They're just going to triage you, make sure you're a good fit for something like that at first, and then get you going on telehealth if that's a good option for you. Myself, I am also offering virtual doula services right now. So you can book a consultation for that online right through my website. And Adora is also hosting another session this Sunday, March 29th at 8:30 p.m., which is going to be pregnancy and birth during a pandemic. So if baby's already here, that's probably not a great fit for you. But if you are still pregnant and looking to give birth sometime in the next 60 to 90 days and maybe affected by hospital policy and restrictions related to COVID-19, that might be a good one for you to attend. So if you bounce over to my business page after this, you can RSVP to that event and get notification when I'm live on that as well. I don't see any more questions in the comments, so I'm going to throw over to Mercedes for just a quick wrap up.
So thank you everyone for joining us. I couldn't hear what Lindsey said, but I really want to thank everybody for coming out tonight. I hope that we were able to answer the main questions that you had and at least give you some helpful information. And don't feel afraid to reach out to either one of us. We're both here for you. We came together tonight because we both really want to support everybody out there and answer as many questions as you can. So we're here for you. Please reach out.
All right. Thanks so much, everybody. And we're going to end it there. Good night.
Bye.